Yali Madat, welcome to the COVID-19 webinar. Thank you so much for joining us wherever you're tuning in from, of course, including the Kenya jurisdiction, that is Rwanda, Burundi, and South Africa. So my name is Malika Kazia, and I'm going to be your moderator for this session. It's all about COVID-19 or the coronavirus, and it is a pandemic that so many across the world are grappling with. So we decided, of course, that you need to hear from the experts, from those who will be able to explain this disease, its effects, and various factors around it to you in depth so that everybody can understand it, can be able to understand what they're supposed to do to protect themselves as well. So today we have a great panel of speakers for you, and they'll be able to explain different factors when it comes to COVID-19. So I have Dr. Mansoor Saleh, Dr. Irfan Samji, Imran Manji, Dr. Shafraz Kazia, and Zara Rashid. So each of our speakers will be giving you insight into a different topic when it comes to COVID-19. And of course, they'll also be able to answer some of your questions at the end of each of their presentations, which you have been sending in via email. So we've put them together and they'll be able to tackle those. You might also find that a lot of your questions are answered through their presentations and what they're talking about already. So I'd like to kick off the webinar with our first speaker, and that is Dr. Mansoor Saleh. So he will be talking about the virus, about COVID-19, its symptoms and how it spreads. So just before we get to you, Dr. Mansoor, of course, I'd like to tell everybody that Dr. Mansoor Saleh is the Professor of Medicine and founding chair of the Department of Hematology Oncology and founding director of the Cancer Center at the Aga Khan University in Nairobi, Kenya. He was formerly at the University of Alabama at the Birmingham Comprehensive Cancer Center, and that was as leader of the Phase 1 Early Drug Development Program. And actually, he's since moved to Nairobi to establish an academic oncology program with a focus on clinical care, research, and education and training. So Dr. Saleh, over to you.
Thank you, Malika. I'm glad to be here. I came to Nairobi 3 months ago. I did not bring the coronavirus with me, but I'm glad to be in Nairobi with you. So my topics will be talking about the virus, what the Jamaat should know. And this slide shows the virus attacking tissue. A virus is an object in a way that does not live on its own. It has to infect a cell in order to use the machinery of the cell to grow. So the only way a virus can propagate is it infects a cell and uses the DNA machinery of the cell. And this is the coronavirus using the cells in the lung to be able to replicate. So what does the coronavirus look like under an electron microscope? It looks like a big bubble. Inside, you see this ring that looks like a necklace. That is the RNA. That is the genetic information that it inserts into a cell and makes the cell make more viruses. So if it were to infect my cell, this RNA would tell my body to make more viruses. The way it gets into my body is through those little pink nodes, those spikes. They go into a donor cell or a recipient cell by sticking those spikes into the cell, injecting their DNA, the RNA into the human cell or any other cell, and thereby infecting the individual. Now, you've heard about the coronavirus must have come from civets or bats. Some animals can live with those viruses. It does not attack them, it does not kill their tissue, so they become the reservoir of those viruses. When that virus jumps from one organism, animal, a civet or a bat, into another organism, it might mutate. And the feeling is that that might have happened to cause this pandemic, whereby this docile coronavirus got into human cells, may have mutated and become very virulent. Virulent means it really spreads very quickly through the aerosol. Aerosol means little tiny droplets in the air. So the next slide shows what happens. On the right, you see symptoms. All of us know those symptoms: fever, cough, shortness of breath, total
Dr.
ache.
Saleh,
Yes?
Dr. Saleh, I'm sorry, I'd like to interrupt you. Maybe we'd like to see the presentation. So if you could kindly share screen as well so that everybody can see it as you speak.
Sorry, my fault.
No worries. Thank you.
Let's get back. Do you see it now? Do you see my screen?
Yes, we can see it now. Yes.
Sorry. We practiced to the hilt yesterday, and I thought I was perfect, but here I
It's
am
all
again.
right. It's technology for you.
So let me start again. Here's the virus I talked about that infects certain cells, and you can see all these yellow bubbles growing in lung tissue. It uses its RNA to insert into the lung tissue, and now the lung tissue makes more viruses. And this is the bubble I talked about. You can see here the coil in the middle, which is the RNA, the genetic information. It uses those pink knobs to infect a cell, inject its RNA into the cell, and now the cell, the recipient cell, will make more viruses because this RNA genetic material tells your body to make more viruses. So my cell that is infected stop making my protein and it starts making the virus's protein. That's how my cell makes more viruses over time. And as we talked about, there are some animals that harbor these viruses that are not pathogenic to them, they do not cause illnesses. But when we somehow get those viruses from another organism into ourselves, there may be a mutation which leads to this infectivity, where this virus is very virulent, very infectious, and it infects others through droplets, tiny bubbles of mucous membrane or saliva or moisture, which contains millions of viruses, which is how it is spread. So on the right-hand side, you have symptoms, fever, cough, shortness of breath. You've been watching TV. Boris Johnson, you could see about a week ago, was running around. Then about 5 days ago, he started looking a little bit puny. That's what happens to us. You really get a little bit sick, tired, fatigued, not doing very well, fever, cough, shortness of breath. Obviously, when you have those symptoms, you have to get medical attention. And I will tell you what happens when you get those symptoms. What is happening is, in the first 3 or 4 days after you get infected by the virus grows in your body. Your body has not been able to attack and fight off the virus. It grows in your body. By around day 7, your immune system now starts to make an immune response, antibodies against the virus. But in the meantime, the virus has grown to millions in your body. You're feeling sick, you're tired, you're in bed, but your immune system is still not working enough to combat these viruses. By day 14, 2 weeks after you got infected, the immune system is powerful enough to eradicate the virus and you feel better. Well, the reason it takes 14 days is it takes that long for your immune system to really mount a response to fight the virus. So the first few days when you're symptomatic, when you have symptoms of cough, shortness of breath, you are shedding viruses. But even the few days before you become sick, you are shedding the viruses. So when you hear what you in town, the asymptomatic carrier who has no symptoms may be shedding viruses. The symptomatic carrier will be shedding viruses. By day 14, you get well, your immune system has killed all the viruses, and now you are free of infection and you can no longer transmit, which is now what happened in those 14 days. And we'll talk about the mask, and my colleagues will describe that as well. So here we are, fever, cough, shortness of breath, typical symptoms we all know about. And see what's happening. It started in China. We don't hear much about it now. We do not even know if the data was very accurate, but it happened very quickly in a certain sector of China. Then it comes to Southeast Asia, Singapore, etc. Then comes to Europe, and then very quickly comes to America. How can that be? It's possible because individuals infected from China traveled to other countries, infected other people who in turn infected somewhere else. Now remember, I showed you this slide. You don't see any wings on this virus. This virus has no wings. It does not fly to you. You come to it or somebody brings it to you. So the main thing is, it is those travelers who came, who may have been symptomatic or asymptomatic, who may have spread it in the community. This is where we are. Look at Africa. Africa at the moment has a hotspot in South Africa because of travelers going to South Africa. But the hotspots in West Africa, because of travel from North America, we are without many hotspots, but it is coming our way. The wave is coming our way. And so we have time to protect ourselves before it gets too late, before we become red hot like America or South Asia or Europe. So look at this. We do not know how many people get infected. Is it 1% of the population or 5% of the population? Probably it is less than 1% overall. Most of those people will get sick. Approximately 20% or so of those who get sick will have to go to the hospital. So let's say 20% of those who get sick are sick enough to go to the hospital, which is the light blue bar. You can see the light blue bar. Of those who go into the hospital, approximately 20% of those will go into the ICU because they're very sick. They have to get a breathing machine because they cannot breathe very well. So of 100% of the people who get hospitalized, about 20% or so, 20, 30% will go to the ICU. Of those, of the total, about 5 to 10% will not survive. So the number that go to the hospital is very high. The number that don't survive is quite low. However, there are certain populations whose outcome is not good, which is why we say the elderly above 65, those who have diabetes, hypertension, obesity, other conditions that can cause trouble already, when they get infected, the immune response, the immunity against the virus is not very robust, which is why they can get sick earlier, they can get to the ICU faster, and their outcome may be poorer. So we'll talk about what needs to be done. This is what happens to the lung. What happens though is, as I described to you, this is the virus that infects you through those little pink knobs. The immune system will fight those knobs and cover the knobs so that these knobs cannot make the virus stick into your body. That is what the immune response does. So by day 7 or so, you're starting to mount immunity. By day 10 or so, you're getting better. By day 14, you are fine. What happens to those people who really get sick? What happens is that immune response is so strong, initially, it cannot fight the virus. By day 15 or so, they should have really cleared the virus, but the immune system is so robust, so rapid, it starts not only attacking the virus, but also attacks your own system. So for example, the virus is attacking my lung. By day 7, my immune response is not good enough. By day 10, it is good enough. The virus should now start going down because it is being destroyed. By day 14, I should be cleared. However, some patients, by day 14, the immune response is so strong that it attacks not only the virus in my lungs, but it also attacks my lungs, which is why patients get very short of breath, cannot get enough oxygen in the bloodstream, and have to be put on a ventilator or a breathing machine. That is why some patients get into the ICU, get very sick, have to be ventilated. We need to avoid that, obviously, but we have no choice. We do not know who will get into the ICU, who will need a ventilator. The most important thing is we are trying not to get to be hospitalized. So let's talk about that. This is what happens to the lung. The top row you can see is the patient's lung. Here, the beginning, a little bit of pneumonia here, more pneumonia here, here, here. And then it's starting to get cleared. Pneumonia is going down. So when you're ill, coughing, you might have a little bit of pneumonia. By day 10, getting worse, coughing quite a bit, going to the hospital, but you do not need the ventilator because your immune system starts to clear the pneumonia. On the other hand, some patients have so much of the pneumonia, they cannot clear it. So here we are. This patient has the lung full of dots, all of which are inflammation. This patient probably needs to have a ventilator. That is what's happening in the patient's lungs. So stop the spread, as I told you before. The virus has no wings. Either you go to the virus or the virus comes to you. So the best protection is staying indoors, not going out. And for those who go out, do not expose yourself to anybody who might have the virus. But some people have no symptoms and may still be shedding the virus, which is why we say protection with a mask, hand washing, so that even if you got some viruses on your hands, you wash it away and you are clean. You stop any viruses from outside coming to your face or to your mouth, and that's why we wear a mask. So the key protection is obviously avoiding being anywhere where there is a virus or inviting anybody to you who has the virus. But look at this. Look at the blue. The blue was the MERS virus epidemic. Very few people were infected. Mortality was very high, 35% mortality, but the caseload was only about 2,500 patients. COVID-1, which was the SARS virus. Remember, we had to go to Jamaat Khana, pialis were swapped to paper cups. COVID virus had now more fatalities. Let's see here, 744 fatalities, but the caseload was much higher than 2,500. It went up to about 8,000. So the overall mortality was about 10%, much lower than the MERS. But look at the SARS. Mortality is less than 5%. But this is data from about 2 weeks ago. 500,000 people in the world had the infection, and 4.5% became 25,000. Today, 1 million patients have the infection, and 5% of that will be 50,000. So there are many more cases, many because many more people are infected, even though that mortality is lower than for SARS or for the MERS virus. It is because this virus is so virulent, it seems to attack everybody that it's exposed to, as opposed to MERS and as opposed to SARS. So what can we do? Stay indoors. Don't lock yourself up. You need to have fresh air, but avoid going to the virus or the virus coming to you. Physical distancing. I think we do not pay enough attention to that. You may not be able to do it at home, but clearly if you have to go to the grocery store or anywhere else, physical distancing, very important. Hand washing, sanitization is very important, and wearing a mask, very important. It's not everybody who coughs that is spreading the virus. Even the person who's not coughing may already be infected, not symptomatic, and spreading the virus. Absolute and frequent hand hygiene, every time. Since even those who have no symptoms can shed the virus and infect others, you have to be very careful about people around you. Recommend masks for all, especially when you venture out. If at all possible, do not get infected. Avoid contact with others. Best of all, stay at home. This is the best time to stay at home and improve your home environment. And what should you know? It is normal, acceptable to feel afraid, to be depressed about this, and to be scared. I am too. Although I'm a doctor, I see COVID patients every day, but I too am scared about me, and my family asks me, how are you doing? I want to protect myself, and I do. But we should not feel hopeless. There is hope. There are remedies to this. We may not have a cure, but we certainly know how to protect ourselves. We should reach out and touch virtually, not physically. Get in touch with our neighbors, our friends, virtually, Zoom, phone, TV, etc. No better time than now to connect with each other. But if you are in trouble, if you have symptoms, call for help. The Jamaat institution, you will have Zara talk to you about this. We are there to help you. But first, you have to help yourself. We are one Jamaat, but importantly, we want to be sure that all of us protect ourselves first, and then the Jamaat can help you if you get overwhelmed. And I have a few messages for us, and those messages are here. This was Hazimam, he says, this is a message you received recently from Hazimam through Malik Talib. And Hazimam said that, at that time said, please convey my best maternal loving blessings to my worldwide Jamaat and tell them that I think of them every minute of the day, each day, and I pray for Mushkil Asan for their peace and happiness. We must remain strong and prepared to build and to build well when this crisis passes. The Imam says it will pass. And when it does pass, we have to build stronger systems so to be able to be protected for the future. This is him to us. It will pass. We have to hope, and we have to do our best on our own. And as Mom said in 1983, a long time ago, There are those who enter the world in such poverty, they are deprived of the means and the motivation to improve their lot. It is for us who are more fortunate to provide that spark. This panel you have in front of you, members of the Jamaat, leaders of the Jamaat, are the ones who maybe, in a way, are fortunate. So it is our responsibility to come out to you and to help those who may be vulnerable. But the most important part is hope. And in 1996, when Hazrat Imam was at Brighton University, I happened to be there. Hazrat Imam said, the right to hope is the most powerful human motivation I know. So most of us, despite feeling scared, had to be hopeful that it will pass, that the Jamaat will be there for you, that you yourself can do something for this, because the virus has no wings, it will not fly to you. You just have to avoid getting it into your house and to make sure that you're protected. And I think that is my last slide.
All right, Dr. Saleh, thank you so much for that presentation. We took away a lot from it. Of course, there was a lot of insights coming from you as well that we really appreciate, especially that invigorating message of hope at the end. So that was our first speaker. Let's now move on to our second speaker, and that is Dr. Irfan Samji. He is going to be talking about infection control. So let me tell you a little bit about Dr. Irfan. He is a quality and patient safety physician and infection control liaison at the Aga Khan Hospital, Mombasa, and AKHB board member, convener for Mombasa as well. So Dr. Irfan, I'll let you take it away. And of course, kindly do remember to share screen so we can all see your presentation as well.
Ya Ali Madad, and good evening, everyone. Small technical challenge on my side, so I won't be able to share video, but my slides will be shared remotely. I think the rest of the presentation should go quite seamlessly. So I will be talking to you a little bit about infection prevention and control. Basically what you can do to keep yourself from getting infected from the coronavirus, and what you can do once you feel you may have been exposed. What are some of the things that you can do to take care of yourself and prevent anybody else from getting infected. Next slide, please. So this is the breakdown for the presentation. We'll look at some of the statistics globally. We'll look at some of the African numbers and what exactly this means for us. We'll talk about transmission. So how exactly would you get infected by the COVID-19, and how you can prevent yourself from being, how you can prevent yourself from being infected, and what would you do if you have symptoms. Next slide. So looking at this slide, we have some global statistics, and you can see total number of cases has gone slightly above 1.3 million now, with roughly about 76,000 deaths, and almost 300,000 patients having recovered from COVID-19. Next slide, please. Now here you can see some numbers for Africa, and you can see the section that's highlighted in yellow. These are the numbers for Kenya. You can see we've had a total number of 172 documented cases, with about 14 cases that have been identified in the last 24 hours. And we've had a total of 6 deaths so far. And you can see our numbers in relation to some of the other African countries. And you can see that while our numbers may be alarming, significantly lower than South Africa, for example, but this is both good and bad. So while you're seeing 172 cases, it's important to note that this may not be the real number out there. Okay, so we may have a lot more infections out there in the country. But what you also need to understand is that we've had a number of cases reported, or rather an increase in number of reported cases over the last few days. This also means that the government is now able to pick up these infections quickly. And as you can see from some of the government directives that have come through, we are expecting some mass testing to roll out over the next few weeks across the country. So what this means is that you can expect to see a lot more cases coming up, but this means that we're now able to pick up, because of flexibility of testing, we're able to pick up more numbers. And this means that we're able to put a number of measures in place to take care of the infected individuals, and also to be able to prevent further transmission. It's also important to note that, for example, while some of these cases have been reported today, this doesn't mean that these individuals have been infected today. All right, there's been exposures that have already taken place over the last few days. and these are now being picked up and reported. Next slide, please. So here you can see an increase in the number of cases that have been reported in Kenya. So just as I said, while you may expect some more cases reported, this will allow the government to put a number of measures in place. It's also important to note that, sorry about that. It's also important to note that we have had a number of government directives on social distancing, on being able to stay at home, and certain containment of certain of movement in certain counties. So we are also expecting that these interventions will play a key role in being able to prevent transmission of infections. So maybe not so many more cases coming up, but let's see what the next few days have in store for us. Next slide, please. So moving on to the transmission of COVID-19, ultimately it still remains person-to-person spread. That means you would spread it from one person to another. And how this is done is by close contact, all right? And this is why we've talked so much about social distancing and now physical distancing, making sure that you are not within 6 feet proximity of each other. If you, for example, we have essential workers who have to be at work. And if you need to have a face-to-face sit down with 3 or 4 people, then make sure you have implemented good distance, good social distancing between, physical distancing between each of you. The other way that it spreads is, of course, respiratory droplets. So if you're coughing, if you're sneezing, and you cough or sneeze into your hands, and you shake somebody's hand, that's one way that you would transmit it from one person to another. And that is why we have focused so much also on avoiding handshakes. All right. While you may be shedding the virus, if you touch one of the frequently touched objects, so for example, if you've touched a doorknob, or you've touched your TV remote, for example, at home, and somebody else touches that, then there is a possibility that you may be transmitting it from one person to another through some of these commonly frequently touched objects. Something that's important also is, for example, for healthcare workers who are doing certain procedures, there is a risk of being able to inhale some of this virus through certain procedures. So for example, if you're putting in a tube that will help your patient to breathe, if you are doing certain procedures like chest physiotherapy, then there is a risk that you may be exposed to aerosolization of the virus. So it's important that you take certain measures, which we'll talk about in the next few slides. Next slide, please. So what can you do to prevent transmission of COVID-19? We can't stress enough, please stay at home. If you stay at home, you will stay safe and you will keep everybody else safe, all right? There has been a lot of focus on social distancing and now physical distancing. So make sure that if you are going out, try and avoid crowded places, keep a good 6 feet distance from others as much as possible. Stay away from people who may be sick as much as you can. Avoid touching your face. So this is one of the ways that you can actually get the virus into your body, right? So through your eyes, through your nose, through your mouth. So avoid touching your face as much as you can. Make sure that you clean your hands. Clean hands are safe hands. And we'll talk about exactly how you can clean your hands most effectively in one of the slides coming up. And then also make sure that you clean your surfaces, specifically your high touch surfaces. So your doorknobs, your tabletops, your computer keyboards, your phones, and I'll explain to you exactly how you can clean some of these items. And then use appropriate protective equipment, whether you work in a healthcare facility, and we have very different protective equipment for the healthcare teams, but even as you go out into the community, please make sure that you put on a mask. This has been also advocated by the government. And so one thing that I need to bring to your attention is that we have seen a number of people out in the community putting on gloves. I'm not sure if that's the safest way to do it. My humble opinion is to avoid wearing gloves because you may be wearing gloves and thinking you're protecting yourself, but you may actually touch your face with those gloves. So I'm not exactly sure if that's very effective. It is most effective that you put on a mask and then make sure you practice hand hygiene effectively. At the bottom of your screen, you'll see a box that talks about vulnerable persons. And Professor Saleh had already mentioned that we have we have to keep an eye on some of our vulnerable populations. So for example, you've got patients who may be over the age of 60, whether they have comorbidities or not, we need to keep an eye on them. We may have persons below the age of 60 who have certain comorbidities. So for example, people who have asthma, people who have diabetes, hypertension, heart disease, for example. Then we've got persons who may be pregnant or breastfeeding. All of these fall under the vulnerable persons category. And then also we've got people who may not have a very strong social support structure. All right. If you've got, for example, an elderly person who lives alone, or if you've got a group of elderly persons who live in a shared accommodation, who may have the ability to do things, who may have limited capacity to do certain things independently, we need to be able to protect them as well. Now, as much as we are recommending that you stay home, if you must go out, then there are certain things you need to be able to do when you come back home. First things first is, of course, clean your hands once you come home. Most of the infection control forums across the country have talked about, or have recommended rather, having a separate set of footwear that you would wear outside and something different that you would wear inside. So as you come into your home, make sure that you change your footwear as you're coming in, and that would be designated to within your home. Make sure that you clean your hands immediately, as quickly as you can. So for example, personally speaking, I've got a sanitizer right next to the door. As I come in, I clean my hands, change my footwear, and then I proceed to take a shower. So that's the other thing that's also recommended. Proceed very quickly to change your clothes and take a shower, and then interact with your family, all right? Especially if you have elderly persons living with you. Some of you may have young children in the homes, so we need to be mindful of everybody else in the home. So clean yourself before you interact with anybody else. We've also had certain questions, for example, what can we do to keep our house helps safe? All right. So of course, as your house helps, if possible, you can have stay-in-house helps. If that is not practical in your respective settings, then of course make sure that you have talked to your house help about what COVID-19 is all about. I'm sure they may have heard of this from various platforms out there in the community. But nevertheless, please speak to them about COVID-19. Speak to them about some of the signs and symptoms that you already know. Let them notify you immediately if they have a fever, if they are coughing or sneezing, if they have any of the chest symptoms that are very common with COVID-19. And then make sure you have the county hotlines for your respective counties. Make sure you have them handy, and encourage your staff, even in their own homes, if they develop symptoms, they can call the respective hotlines and report and get assistance. If they need to go out to collect anything, to pick up some supplies, it's recommended that they put on a face mask as well as they leave. When they come in, they should clean their hands as well immediately. It's also recommended that they have a dedicated set of clothes or uniform, if possible, for them to work while they're in your home, and something different to wear as they are stepping out into their environment, because you don't specifically know who they're coming into contact with out there in the community. Next slide, please. Now, this slide talks about hand hygiene, right? So hand hygiene focuses on both hand rub, which means when you're using an alcohol-based hand sanitizer, and hand washing, which is when you're using soap and water. Of course, liquid soap is recommended in most settings. Now, this slide that you're seeing here, the posters on the steps for hand hygiene is used very frequently in healthcare settings, but there is absolutely no harm in being able to share this with the community. So I'm sure we can always send this out to you. You can have a look at it. Effective hand washing also means, or hand rubbing also means, that you've captured all your steps effectively. There's about 8 steps of hand rubbing, for example. So just make sure that you are familiar with that. There are areas of your hands that are easily missed. For example, your thumb, your wrists, your knuckles, and all of these need to be cleaned very well for your hand hygiene to be considered effective. If you look at the bottom right of your screen, we've put some of the time frames for your hand hygiene to be considered effective. And this is often considered contact time. What that means is for how long would you expose your hands to a cleaning agent for you to consider them safe enough. All right. So the recommended guidelines is 20 to 30 seconds if you're using a sanitizer, and 40 to 60 seconds if you are using soap and water. If you can't remember this time frame, then just remember about 30 seconds for sanitizer and 60 seconds for soap and water. And this also comes in from what you've seen the government recommending 20 seconds, and that is really the bare minimum. For any hand hygiene to be effective, it has to be at least 20 seconds. An interesting fact from the World Health Organization is that, especially for the community, if you're not sure what exactly makes up 30 seconds or 60 seconds, you can do each step of your hand hygiene for about 5 to 10 seconds. Alternatively, you could hum the happy birthday song in your head. Actually, that works quite well. If you do it for about, if you do it once, it's about 30 seconds. If you do it twice, it's about 60 seconds. And if you look at the green box on top of that, we've got some guidelines on when you can clean your hands. Of course, the rule of thumb is as often as you can. So if you can carry a sanitizer, a pocket-sized one with you when you're going out into the community, if you must. Of course, clean your hands after you handle money. There's been recent focus on trying to go cashless within the country, so go cashless if you can. But the moment you do handle money, you need to clean your hands. Money is considered one of the most infectious items out there right now. Of course, if you're in a bank, for example, or if you're in a hospital and you're using some of the shared items like a pen, make sure you clean your hands immediately after using things like that. If you're actively coughing or you sneeze or you're blowing your nose, make sure you clean your hands immediately after. And then, of course, in the home, before, during, and after preparing your food, make sure you practice hand hygiene before you sit down to eat, after using the toilet, and after handling garbage as well. And there's many more places where you can practice hand hygiene. But take-home message from this slide is as often as you can. Next slide, please. So this is focusing on cleaning, what you can do within your homes, within your offices, just to make sure that your environment is a little more safe from the COVID-19. So what is recommended by CDC is, of course, soap and water generally would work for cleaning. If you are disinfecting your surfaces, you can use either an alcohol-based product that contains at least 70% alcohol, or you can use any product that contains bleach. And you can prepare this for yourself at home or in the office, and you can use about 5 tablespoons of bleach or about a third cup of bleach, and you put that in about a gallon of water. And you can spray that on some of your surfaces, allow it to sit there for about a minute before you wipe it off. And you could use, for example, for your electronics, which is the fourth icon there, some of your frequently touched electronics like your mobile phones, or if you have a keyboard that you're using, your TV remote, you can wipe them down with alcohol-based wipes, which are available in the market. You may be able to spray them down, but just make sure that this is in line with some of the manufacturer's guidelines for the products that you're using. For some of the soft surfaces like your throw pillows or your rugs, soap and water also works, but you can use manufacturer's guidelines on cleaning them if you need to take them to the laundry and things like that. For anybody who is sick, especially, and you need to do laundry for that person, it's recommended that, of course, we segregate the individual's laundry. Make sure you use the warmest water possible if you're using a washing machine. And of course, you could use bleach where applicable for your clothes, all right? Again, clean your hands as much as you can. For anybody who is suspecting that they may have had an exposure and they need to self-isolate, or if anybody has symptoms and needs to self-isolate, then it is recommended that you have a single room where you can self-isolate. It's also preferred that that bedroom has an attached bathroom that you can use for yourself. But of course, if you need to use a shared bathroom, then it's recommended that you put on a face mask when you're coming out to use that shared bathroom. And of course, if you are in a position to be able to clean your bathroom yourself and your bedroom yourself, it's recommended that while you're symptomatic or while you're self-isolating and you're well enough to be able to clean, you clean up after yourself. If you're not in a position to clean and you need somebody to assist in cleaning, then it's recommended, for example, after using a shared bathroom, have it vacant for as long as possible before your house help goes in there to clean. Of course, make sure that you protect your house help as well. Generally, I would recommend that you provide some gloves for cleaning the washrooms and at least an apron in case of any splashes. and things like that. For food, of course, if you are in self-isolation in your own room, it's recommended that someone drops the food at your door and then you can take it in for yourself as much as possible. And then, of course, the trash that's collected needs to be put in a bag, so your trash can needs to be lined. And then, of course, whoever is handling the trash needs to be in gloves as well. Avoid, when you're handling trash, when you're handling your laundry, avoid shaking it too much, just to avoid any possible aerosolization of the virus at that point. Next slide, please. So this slide shows you some of the personal protective equipment that is available. This is predominantly used in healthcare settings, but while there is a focus on using some of these equipment in the public, you need to know how to use them appropriately. So for example, as you're going out into the community, put on a face mask. What is recommended is that you use a disposable face mask as much as possible, but while this may not be absolutely practical in every setting, and if you need to use a cloth mask, for example, there are various types available in the market out there. You can check with the Arkan Health Board before you procure this. We have some information that we have worked on, so we can guide you before you purchase any face masks. Some of the face masks that are fabric based out there do have a filter in them, so it would be advisable to go for them as well. And then, of course, if this is a reusable face mask, you want to be able to handle it safely once you've used it. So the recommendation, if you're using a reusable face mask, is drop it into a solution with some disinfectant and some bleach. Let it sit there for a while, and then you can wash it up. It's also recommended that you clean it with some hot water. There's also been some guidelines on, for example, being able to boil it in hot water, for example, for 5 minutes, and that should be able to kill any virus that may be on the face mask, and then dry it up, and that should be safe for you to use going forward. So we have some guidelines that we will share with the Jamaat in due course. But just remember, gloves, my personal opinion is that it is not entirely safe for community use. So be very careful. Be environmentally conscious when you are using these PPEs, and make sure that you discard them appropriately at all times. That's all from me. Be safe and be blessed. Thank you.
Thank you so much, Dr. Irfan. A lot of insight coming from you as well, especially when it comes to controlling the infection. So now we'll move on to our third speaker, and that is Imran Manji, and he's going to focus on treatment. Now, Imran is actually a clinical pharmacist at the Moy Teaching and Referral Hospital, Eldoret. He also holds a master's degree in public health, that's from the University of Edinburgh. Currently, Imran serves as a member of the Aga Khan Health Board, Kenya, and he's responsible for AKHB's activities in Kisumu as well as district Jamaats. So over to you, Imran.
Thanks, Malika. Just share my slides 1 second. Great. Yali Madat, everyone. Just to get going on this, I will be very brief. Just quickly to talk about some of the common misconceptions that we have with coronavirus currently. As well, I'll also go over some of the treatments that are available, and we'll look at prevention in other ways in terms of vaccines. So the question many people are asking is, can I prevent COVID-19 infection by doing certain things? So some of them are, what about drinking hot liquids or gargling with hot water? Others are taking vitamin C or supplements, sitting in the sun. I know there's been a lot going around on social media that people have been talking about, saying that because Africa is hot weather, the virus cannot be transmitted in this weather, but we're already seeing that it is being transmitted locally through the community spread. So definitely sitting in the sun will not help prevent you from getting the virus. Inhaling steam or hot air, eating garlic, some other home remedies people have been using. I've heard of kalonji, using Vicks. Some people talk about drinking ginger, garlic, turmeric. So all of these, we know that there is no evidence
that any of these can prevent or treat COVID-19 infection. One thing to think about is that some of these could actually be harmful if not done well. For example, inhaling very hot air can actually be damaging to your lungs. And so you need to take these cautiously. Secondly, I would advise the Jamaat that be careful about what you read on social media. Not everything that you see is true, unless it is coming from a reliable source. For example, the WHO, the CDC, Ministry of Health, and Aga Khan Health Board, among others. So here are some of the other myths, you would say, that have been debunked. For example, inhaling steam, as we talked about, gargling with warm water, salt water, bitter gourd juice, drinking alcohol. Even as disinfectants, it is not recommended that you apply chlorine to your body. It might be harmful. So all of these actually have been shown not to be effective to cure. However, I would say that because this is a virus that affects the respiratory system, and oftentimes when we are sick, when we have the common cold, we sometimes use these remedies to provide symptomatic relief. And so I think some of the guidelines, even for example in India, are recommending we use these, but not as treatment, but for symptomatic relief. So they will not prevent you from getting the virus. You will not get cured from taking these remedies, but it could potentially help you with the symptoms. So you might feel a little better. So when we are sick with a cold, we often drink hot liquids and we sometimes feel better. So this in one way would help, but it's not necessarily, I would highly recommend not to think about any of these as a cure or as a means of preventing you from getting the virus. What will prevent you is what the previous speakers have talked about. For example, staying at home, social distancing, washing hands, all of that that has already been talked about. That's what will hopefully prevent us from getting this virus. So the next question is there a cure for COVID-19? Unfortunately, at the moment, there is no known cure. The current treatment is only supportive care. So if you have a mild infection, you will manage it at home. Of course, you should call the Jamaati helpline. We'll talk about that. And then manage it like you would any other viral disease at home, which is, for example, a common cold or a flu. Managing the fever, the cough, and then if you do feel like it's getting severe, where you're getting shortness of breath, then you need to go to the hospital. And then we have the helplines from the Aga Khan Health Board, the National Council, that you can call in case you feel like you are having worsening of symptoms. And that's when you'll be advised to go to the hospital. And then I just want to talk a little bit about drugs. There's been a lot in the media again about many drugs being investigated. The key objective of these drugs is to try and reduce the amount of virus that would be in your body so that you have fewer symptoms. Unfortunately, none have been approved for treatment yet, but there are drugs, for example, remdesivir, chloroquine, hydroxychloroquine, and others that are under investigation. And so it's important to note that none of these have been approved, and so no one should actually self-medicate with these. Yes, they are being used as a last resort in patients who are not improving on other treatments in terms of supportive care, but I'm really urging the Jamaat that do not go to the pharmacy and buy any of these medications. Reasons being, first of all, all of these actually are prescription medications, so you cannot buy them over the counter unless you have a prescription. Secondly, so it would be illegal for you to buy it. Secondly, they have their own side effects. For example, in people who have heart disease, chloroquine can actually worsen their heart disease. So there are side effects associated with these medications. And then thirdly, some of these actually have uses for other conditions. So for example, hydroxychloroquine, which has been in the news a lot, is used commonly for patients who have lupus. And so by us stockpiling these in our homes, when we're not going to even use them, we may actually create shortages in the country. And those patients who have these diseases and depend on these medications for their lives may not be able to access them. So I would hope that people will keep this in mind as and when these drugs become approved for treatment, and even now. So the next question would be then, is there a vaccine for this? Again, there's not been a vaccine that has been developed. It's under development, but this is a lengthy process. Ordinarily, development of a vaccine takes several years. It can be 3 to 4 years. But this is now being accelerated. But even then, there's so many studies that have to be done. So the vaccine has to be tested in the lab. It has to be tested for safety in trials, in clinical trials. So there's several phases, the phase 1, 2, and 3. So phase 1 is for, you test for whether they're safe to be used in humans. Phase 2 would be for efficacy purposes. And then a phase 3 trial would then be a large trial comparing it with a placebo in real patients. And so this process at the moment is slated to take about 12 to 18 months, meaning that we have to still take other precautions, the non-pharmacological precautions of staying home and social distancing and hand washing that would prevent us from getting the disease. And then lastly, can we use existing vaccines, for example, for influenza, for pneumonia? We cannot do that because the coronavirus is a different virus. For example, influenza, it's a different virus. So it's 2 different molecules will be needed. The pneumonia vaccines that we have currently are for pneumonia by bacterial infection. So you would not be able to use any of these vaccines for the coronavirus. So we just basically are stuck waiting for the next vaccine that comes out. I guess that's where I'm done. Back to you, Malika.
Thank you so much, Imran, for the treatment options that you have explained to us. And now we'd like to take a look at the pediatric perspective of COVID-19, as well as the mental health aspect. And for that, we've got Dr. Shafraz Kazia joining us. He's a medical doctor who has worked with children and families for over 4 years. And he's a mental health advocate. He's pursued his master's in child development in Israel. And he's passionate about children as well as parental mental health. And he's now a parent, a psychoeducator on infant mental health and parenting, as well as a holistic infant and toddler sleep consultant. So he's also a part of the AKHB board and handles the disease prevention and mental wellness portfolio for Kenya and its jurisdiction, Jamaat. So over to you, Dr. Shafraz.
Thank you so much, Malika. Sorry, I'm just trying to get my slides into 1, 3. Thank you. All right, good evening and yalabadat, everyone. I'm here to talk about the wellness for families in the age of COVID-19. I'm sure a lot of us out there don't really focus on families, and it's really important to talk about how families would be able to cope with the current crises around the world. The other thing is, how does it affect children? Because most of the time, again, we forget that children exist. They do get affected. So I'm just going to share a few quick facts on COVID-19 in children. So the disease and symptoms are much less severe in children than in adults, but that doesn't mean that we've not had a few deaths around the world, including one in Kenya just a few days ago. If this infection were to be concurrent with immune suppression or any other chronic diseases in children, that could be heart disease or cystic fibrosis or anything else that is chronic for a really long time, this could have a significant impact on children. So children are becoming, we need to keep in mind that children are being affected or infected at a similar rate as adults. despite rarely having symptoms. So your child may have symptoms of just a regular upper respiratory tract infection. That would be a runny nose, a cough, a mild fever. We've had cases of asymptomatic children, just the way we have asymptomatic adults. There hasn't been much research published for children at the moment, and we're just trying to, uh, some of these bodies like the WHO are just trying to compile that right now. A lot of articles are still not peer reviewed. And so hopefully once we have more research coming up, we will be sharing these pearls of wisdom with the Jamaat. So I would like to urge every parent at this point, just because we have community transmission already, that if your child does have any of these symptoms, and sorry, I did not mention loose stool, nausea, diarrhea, vomiting. These are also part of the COVID spectrum in children. So if your child does have any of these symptoms, it would be wise to contact your family physician, or even better, your pediatrician, as soon as the child starts showing these symptoms. So what should families do to prepare? So obviously, first things first, it's really important to talk to your child about how you're keeping them safe from the pandemic, because it causes a lot of anxiety. So as an adult, you'll feel very inundated with all the information that's coming in through social media. You'll be curious about the numbers that are rising, probably in Italy, Spain, the US, and now that we have rising numbers in Kenya, and that a lot of people are talking about the surge that we're expecting in the next few weeks or months, it is very important for us to sit our children down and just speak to them in a very developmental, appropriate age manner, so that this message is clearly communicated to them. And I will touch more about that later. So again, families should maintain and continue with normal routine as much as possible. And I know normal is not the word I prefer using usually, even on a daily basis, but this is your normal as a family. And so if you stick to all the routines that you usually do, except for, of course, going to work and school, incorporate exercise and everything in your routine, this would be very beneficial for the whole family unit. So how can I work from home and still support my loved ones? Yes, it is possible. You could seclude yourself for maybe an hour or two, or get breaks in between while you're working at home, so that you can give equal attention to other people, loved ones at home, and your children. Follow trusted sites, that is WHO, CDC, and your country's public health, which is the Ministry of Health for us, and also limit your children's exposure to media. So if you think you need to watch news on a daily basis, which most of us do, it would be very much recommended to have just maybe 15 to 20 minutes of that while you're alone. And if you have to show something to your children very inspiring about people coming together to fight COVID, then that's the only sort of exposure to media that I would advocate for. Now that a lot has been emphasized by Dr. Irfan and Professor Say and Imran on personal hygiene, this is just a very lovely infographic that I thought I would share with you. So even for children, you should encourage them to cough or sneeze into their arm or their elbow. Sanitize surfaces, avoid touching your eyes, nose, and mouth. I know it's almost impossible to do that, especially with children, but then you really need to make sure that you're cleaning their hands very regularly. So is it safe to breastfeed if you are suspecting or have tested positive for COVID-19? The answer is absolutely yes. Wash your hands frequently before and after touching your baby. Avoid touching your eyes, nose, and mouth. Practice good respiratory hygiene and wear your mask while you're breastfeeding. If women with COVID-19 are too unwell to breastfeed, then alternatively, you could resort to formula, or you could better resort to expressing breast milk. And while all this is going on, you really need to protect the mental health of the mother, because this is when it is especially sensitive with all the hormones flying all over the room. And so whoever is at home with this mother, whether it's the spouse or the partner or the in-laws, you really need to make sure you create a very strong support system. So now I will continue with mental wellness and COVID-19. So I feel like wellness is overrated for a lot of people, because it could be you possibly just being on Instagram, or watching your favorite show, or eating your favorite food, or just going for a run. But I'm sure some of those activities which are outdoor, which are related to wellness, you're not really able to do them right now. So how about we focus on wellness during this pandemic while you're at home? What does wellness mean to you then? Because for me as a medical doctor, wellness means good PPE, and that I protect myself. I get good sleep for more than 7 to 8 hours every single day, if that's possible, and have a well-balanced diet as well. So while you're talking about wellness, social connection is by far the most important thing right now that we can actually focus on when it comes to wellness. It's a fundamental to positive mental health. Connecting with people helps us sleep better, cope with stress, and protect against depression and anxiety. Uncertainty, on the other hand, can cause confusion, mayhem, and unrest mentally and physiologically. Yes, physiologically, your stress hormones will be all over the place, thus lowering your immunity for that possible infection. So I'm very much against this whole terminology when it comes to calling it social distancing. And I recall just 2 weeks ago, the WHO actually mentioned this, that we need to start calling it physical distancing and not social distancing. This is because a lot of people may say, I need to socially distance myself from my loved ones, whether I'm quarantining myself or I am actually isolating myself when I'm actually probably infected with the virus. But this doesn't mean you need to socially isolate. You need to physically isolate yourself. Social isolation can lead to a lot of issues when it comes to mental health and your wellness and your immunity. And so I really love this infographic that the WHO had shared a few weeks ago, talking about disease prevention through maintaining physical distancing. So I hope this is clear.
I just want to remind you, we're a bit time constrained, so we're hoping that we can wrap up a little bit faster.
Sure. All right. So, so how do we address mental health for those with psychological needs? So if you have a pre-existing mental health condition, then make sure you're up to date with your medication. Contact your psychiatrist. Make sure you have at least one weekly session online with your therapist. Ensure you have a strong support system. Facts minimize fear. Stick to news from the government, the WHO, the CDC, and shift narratives away from number of deaths to people who have actually recovered for spreading positivity. So this is something that one of my colleagues made for mental health, and it's your quarantine mantra. So how can you practice this every day? You can actually put this up on your fridge like that, and these are the questions. I'm sure the webinar will be shared soon, so you can actually go back to this slide and make sure that you possibly put this on your fridge or wherever you feel your family can access it, and go through each one of them every single day so that you maintain routine. And now that we're talking about being grateful, why am I grateful today? I'm going to show you this picture from 100 years ago when we had one of the world's worst pandemics. And this was the Spanish flu that hit the world in 1918. Notice how inefficient their mosques are. On the other hand, yes, these people are, this is basically what we look like on the road right now. And I would want to mention this with gratefulness is because at that time, nurses actually, the only thing nurses would give their patients was soup, some vitamin C, some orange juice, and maybe some cough syrup while their lungs were drowning in the cytokine storm. And so I think we need to be grateful for the day and age that the pandemic has hit us, that we're in the 21st century, and that doctors, governments, healthcare workers, the CDC, the WHO, everyone is working together to fight this pandemic. So what can I do for my wellness? So like I said, I would focus on routine. Routine is the essential key. A balanced diet, exercise, and sleep hygiene. Now, why sleep hygiene? So a lack of sleep, so studies have, there was a study conducted a few years ago on the rhinovirus, which is basically when we're talking about influenza, is that those who had less than 7 hours of sleep actually had a 40% chance of contracting the flu itself. So you can imagine how sleep hygiene is very important, and that once you maintain your hygiene, you're also protecting your immunity. So my favorite topic, and I will go through this really as fast as I can, Malika. So how do you parent during quarantine? How do you parent in the age of COVID-19? So first of all, it's very important for you to shift your emotional tone when talking to your children. Children can sense hesitation and anxiety very easily. And ultimately, you need to be that person, that secure attachment for your child, and be a safe haven for your children. So if your children are very securely attached to you, and when they feel scared during everything that's going on right now, whether they've watched news or they've seen a relative talk about something, or they've just heard about a death in Kenya, how are you able to cushion your child from that? So first of all, it's really important for you to develop your child. You need to disseminate this information to your child at a developmental appropriate age. What does your child understand right now? If you have a 10-year-old and a 3-year-old or a 5-year-old, you need to speak to them differently, in a different tone, in a different manner, and be very concise and careful about what you share with them. Give attention to how people are coming together to avoid the pandemic. So that is actually a beautiful thing right now that we're seeing, that we're actually fighting this virus as the human race. It doesn't matter whether you are Black, Indian, white, or you're Asian, it doesn't matter. We're all coming together with this as a global community to fight this virus. And constantly thinking about this pandemic actually puts our brains into survival mode, where the only thing that our bodies are reacting to at that point is a fight, flight, or freeze response, because you are always looking for danger. And that is especially harmful for parents and children, and also the elderly. So just to avoid that, try and look at the positive in things. I know it's really hard, especially for those of you whose job on the line right now, their financial constraints. The world economy looks really bad at this point. But all we can do is just to stay very positive and say that this too shall also pass. If you're talking to youth now, it is very important, because youth usually generally seek connection. They love hanging out in groups. They love hanging out with their friends. How do you talk to them? Are you going to say you're grounded? No, you can't really say that. So it is really important for you to share that message with them. And also, as a parent, you need to cultivate your own wellness, practice gratitude, mindfulness, and playfulness with your children. So these are just a few quarantine recommendations for mental health and wellness. And I'm sure these slides are going to be shared with you. And so I just want to say, ask for help. It's okay to tune out from news. See some wonderful faces, connect with your family and friends. Stay connected. Stop saying social distancing. Start practicing physical distancing. Adapt your self-care routines. We can't go to the gym right now, so join up for an online program on yoga, workout, or something like that, or CrossFit. I'd just like to end this presentation with something that I came across 2 days ago. This is from someone who survived 4 concentration camps. And here he says, when we're no longer able to change the situation, we are challenged to change ourselves. Thank you so much, and Yali Madad.
Thank you so much, Dr. Shafraz, and we really appreciate all the mental health tips as well. But now we'd like to go to our final speaker, and that is Zara Rashid. Of course, she is the chair of the Aga Khan Health Board Kenya, and she's an optometrist who qualified from the Cardiff University, where she did her undergrad as well as master's degrees. She's currently in private practice as a consultant, providing specialized eye care services at the Gertrude's Children's Hospital. Now, she's also currently a PhD candidate at the KwaZulu-Natal University in Durban, and she has been actually the AKHB Kenya chairman, responsible for the Jamaat in Kenya and its jurisdiction for the past 4 years, and is continuing as seva for the next 3 as well. So Zara, over to you.
Thank you, Malika. Yali Madad. Thank you all for joining us today. As I wrap up today, as a National Council, we have endeavored to educate the Jamaat, keep you informed, and support you through this pandemic as it evolves. I'm sure you have seen the WhatsApp messages, daily live stream sessions, videos, and many of the elderly will have received phone calls from the care of the elderly team, the youth, Mukhi Kamriya Sahibs, and Mukhiani Kamriya Nimaz. Specifically for this pandemic, we have set up the Jamaati helpline. If you dial 1, you will have the option of being directed to the hotlines for the Aga Khan hospitals in Nairobi, Mombasa, and Kisumu. If you dial 2, you will be directed to safety and security. Should you need to speak to a doctor, they will direct you specific health-related questions to our Ismaili volunteer doctors who have pledged their time and knowledge for our Jamaat 24 hours a day, 7 days a week. We are requesting Jamaati members to avoid physical visits to the hospital, but we don't want you to ignore your non-COVID illnesses. If you are unwell, speak to your doctor or even talk to our doctors on call. They can advise you if you need to go to the hospital for a physical consultation. If you dial 3, you will be directed to our community counseling support team. Should you require any support, please talk to them. We have been working very closely with all the Aga Khan hospitals in Nairobi, Mombasa, and Kisumu, and I would like to assure the Jamaat that their COVID-19 preparations are ongoing. However, as has been mentioned before, prevention is better than cure. It is important that we all follow the prevention guidelines to minimize our chances of being infected and eventually hospitalized. Should you think you have COVID-19 symptoms, use the safety and security option and ask to speak to one of our doctors on call. They will keep your information confidential and they will guide you. Please don't be afraid. We are here for the Jamaat. We are here to support you, whatever your needs be, whether it is health, economical, social, religious, we are here for you. Call us, talk to us, and inshallah, we will get through this together. Ya Ali Madad. Thank you, Malika.
Thank you so much, Zara, for wrapping that up for us. Now, we did hope to get through a lot of questions, but actually throughout our speakers' presentations, a lot of your questions that did come in have been answered, but those that we did not get to or we do not in the next couple of minutes, of course, we will continue to engage with the Jamaat, and that is through various platforms that we already have, and answer those questions that may have been left out. But even as we wrap up, just a couple of questions that I would like our speakers to address that have come in from the Jamaat, and one of them is the use of different medicines when it comes to supplements. supplements. And Imran, perhaps you can take that question, which was actually asked by a Jamaati member. And I can get that particular question for you and exactly what they asked, because it came in shortly. So the question that came in was, as the virus affects people more with immune deficiencies, should we be having immunity supplements for those who are generally prone to coughs and colds? Imran, what do you say?
Thanks. As I said earlier in the presentation, when I mentioned things like vitamin C, currently there is no evidence to show that taking supplements could help prevent getting the virus. If you're on supplements for your routine, any of your other medical conditions, you should still continue to take them, that's fine. But specifically for prevention of getting coronavirus, there are no supplements that are known to prevent that. So I would say if you're worried about immune response, I think just maintaining your regular healthy diet would be good. And then just following all the prevention measures that have been given by the government and the health board.
Thank you so much, Imran. And one more question as we wrap up, and that would be Dr. Saleh, is about the masks that came in and which materials are best placed to actually protect people, because there is some confusion when it comes to cloth masks and whether or not they are effective.
It's a good question. It used to be said that we do not need to have masks unless we are involved with patients who are infected. So that was the very sophisticated M75 mask, I believe, or an M95 mask. The reason we use a mask today is all of us should consider ourselves as potentially being carriers. If I'm a carrier, but I'm asymptomatic, I do not want to shed my viruses to anybody else, so I wear a mask. So if all of us behave as if we're carriers, we would all wear a mask. Secondly is, if you're in an environment where there's somebody close to you who's not wearing a mask, and they may be a carrier, their aerosols will come to you, to the eye, to the nose, to the mouth. At least wearing a mask protects you somewhat, because you at least have half of your mucous membranes protected. But more importantly though, psychologically, if you have somebody wearing a mask coming to you, you somehow psychologically will distance yourself from them. So wearing a mask is basically protective for the others in case you are shedding, and also for yourself in case somebody else is shedding to you. For that purposes, wearable cloth masks that you can wash daily are much more better than wearing something you wear every day. Now remember, if you wear a mask and then take it off and take it on all the time, you're probably causing more contamination. So if you wear a mask, you'll be disciplined to be able to take it off properly and put it on again after taking care of it for washing. So I would say cloth masks for most of us, surgical masks for people who are very close contact to somebody who may be infected, and the special M75 or 95 mask for those who are in touch with patients who are infected.
All right, thank you so much, Professor. And that actually brings us to the end of this webinar. So I would like to say thank you to each of you who did take your time and tune in. Yes, we probably overshot a little bit and we apologize for that. Hopefully you got a 360-degree understanding of the COVID-19 pandemic and perhaps what you can do to help yourself, help others at this particular time. It is critical, of course, that we keep that in mind, keep on washing our hands and following what the government's directives are, especially I'm talking to people who are in Kenya. I would encourage you to tune into that daily briefing that comes from the Ministry of Health. It's in the afternoons, it's broadcast on all the local TV channels, sometime around 3 p.m. It varies day to day, but it's critical that you tune in because for one thing, even if you may be, a bit skeptical about the numbers that are being shared, it is giving you the official government position, and it's giving you constant updates on the government measures that are being implemented. And it's critical that you actually get that from the primary source, as opposed to a WhatsApp message later on that may not have communicated the context or things like that. For instance, yesterday, during the president's address to the nation, he said 82% of the cases that we have in the country are actually from Nairobi, hence the particular lockdown of the Nairobi metropolitan area. Not lockdown, that's not the word that was used, but the cessation of movement is what was actually the measure that was taken. So things like that you need to keep up to date with, because you also know what's happening, what measures are being taken, so that you are on the right side of the law and also protecting yourself. So that's how we wrap up this webinar. I'd like to thank all of our speakers for taking their time, all of you for tuning in, and of course, stay safe and keep up to date with what's happening around you and protect yourself as much as possible. So, Ya Ali Madad, and we'll hopefully see you soon.